This edition of Tech Talk is brought to you in part by Telex, the interconnection company, owners and operators of 56 Marietta, the most network-rich co-location facility in the Southeast. Tag TV and Tag Radio. Technology now has a voice of innovation and information. Get it on www.tagtvonline.com. From innovation to actual corporate value, job creation to an endless list of social benefits, Georgia's entrepreneurs are no longer a silent force but an economic engine to be reckoned with, as our state's entrepreneur activity has catapulted us from just a few years ago out of the top 5 to number 1 in all of the USA. Our Tech Talk series on startups, entrepreneurs, and the funding needed to make it all happen continues as we get personal with yet another leading successful example of the quintessential entrepreneur. Our goal is to provide insight into understanding the roles and responsibilities, functions, and challenges of today's innovating entrepreneur to inspire others to take their vision and make it a reality right here in Georgia, right now. Greetings, everyone. It's Tuesday, July 14, 2009, and this is Tech Talk with Technology Association of Georgia President Tino Mantella. I'm your guest host, Frank Baia. His insight was eyesight and a company called SoloHealth, a response to the growing consumer preference for self-directed healthcare services. The product, an interactive self-service vision testing kiosk called, you guessed it, eyesight, that provides consumers with free assessments of their vision, information on consumer eye health conditions, and referrals to local eye health care practitioners. On today's Tech Talk, we meet Bart Foster, CEO and founder of SoloHealth, a proven entrepreneur. With over 14 years of international sales and marketing experience, Bart has worked at Ciba Vision and held leadership roles in sales and marketing in the U.S. and in Europe. In 2006, he was awarded the Entrepreneur of the Year for developing the eyesight business venture. Prior to Ciba Vision, Bart, as VP of Sales and Marketing, assisted an internet startup based in Montreal, Canada, to complete an IPO on the Canadian Venture Exchange. He began his career in consumer marketing and sales at Kellogg. Up to the Tech Talk, former ATDC Cap Venture participant, successful entrepreneur, and now a dynamic CEO of a company now poised to be a world leader in self-service health screening, SoloHealth's founder, Bart Foster. Bart, welcome to Tech Talk.
Thanks. Glad to be here.
Well, let's start. I think anybody with having experienced the idea creation, something where you think, well, I've got a good idea, the concept of taking that and turning it into reality. When you're talking a soft idea, I guess, Bart, that's hard enough. But when you're talking about something like the eyesight vision screening kiosk, boy, that's a whole other thing. How did you come up with the idea for the eyesight screening kiosk?
I actually was working in Europe for Ciba Vision at the time. I was working in the UK and was working with a number of the large retailers that have optical departments inside. And they needed a way to convert their existing shoppers into optical customers. And it just hit me, what if we could have a way to quickly assess if you could benefit from vision correction and provide eye health information and direct you into get an eye exam. The problem is your eyes deteriorate so slowly that most people don't realize it. So this was a way to help educate those people, and it was an idea that I came up with 5 years ago.
Now, for our listeners, obviously we're talking about an in-store or on-site kiosk, not kind of unlike a blood pressure type thing, or maybe describe the kiosk in itself. How does it kind of work?
That's right. So it's a self-service vision testing kiosk. As a consumer, you walk up to the device, you're answering a series of questions on a touch screen, and it's going to present a series of stimulus. And then based on your results and the answers you provide, it's going to provide content as well as a list of doctors where you could schedule an eye exam. And there's advertising from our manufacturing partners, and then it prints out a report that gives you an indication of your visual acuity, both left and right eye, near and distance. It also has valuable coupons and discounts, and again, a list of doctors where you could schedule an eye exam.
So the revenue model is both sort of advertising-driven and referral-driven.
That's right. We get paid from the people who benefit the most. It's the eye doctors who get the referrals, and it's the manufacturers who sell more product.
Go into a little bit of now, we're talking, one of the things that we often joke about in terms of venture capital, if it doesn't drop on your toe, they don't want to get involved in it. This one is a case where you're talking about equipment I'm going to guess, a fairly substantial investment in equipment, so a lot of startup costs in developing the kiosk itself, and then even more capital necessary to create more kiosks to get distribution expansion. Maybe go into a little bit about how all that happened.
That's right. It is. It could be seen as a capital-intensive business. However, we've turned it into something that's a capital-efficient business because we're getting paid for the units up front from both the doctors as well as from the manufacturer partners in what we call a key market driver program, and we're getting strategic companies to fund a lot of our upfront costs in the initial stages.
So in a way, it's almost like selling a franchise. You know, you're taking the unit out as a prototype or as a model of a basic existing unit, but then explaining how it all works and getting the actual participants and partners in advance to the actual placement.
That's right. So we're actually building to order. Once we have the cash in hand to go produce the units, then we go make them and put them in the market, and then add or overlay advertising on top of that with local doctors and manufacturers.
Well, I think it's obvious that's pretty bold, but I think also you kind of had a gut feeling based on your experience for some of these things and apparently the knowledge of the process and the infrastructure, because I think a lot of what you're talking about would have taken some entrepreneurs a fair amount of research and development beyond the idea of development itself to be able to understand and appreciate the knowledge you already had with this process that you're talking about.
Well, and we had a leg up, or I had a leg up in SoloHealth because Vision, where I came up with the idea and started, and I spent 8 years there. They invested in the R&D and the clinical trials as well as the market research. So just like any big company, they would invest a lot in market research and focus groups. And before,
That's pretty amazing that they let you keep the asset while they funded it and developed it. That's pretty aggressive on both your part and theirs.
Exactly. Vision, they saw this as benefiting the entire industry, and just because it wasn't core to their business, they didn't want to just see it die. And it was through sheer perseverance to be able to convince everyone involved that this was something that's going to benefit everyone. Eye doctors see more patients, consumers are more educated, manufacturers get to sell more product, and ultimately we have a population that has healthier eyes.
That's a keen insight that we offer to the listeners, because I think most of us often run from our existing relationships when we're working at a place thinking that we won't be able to hold the idea. Here's a case where they not only embraced it but helped you to make it a reality. That's pretty interesting. Let's talk. Was that your biggest surprise as you evolved this thing, or was there anything else that that has been a surprise for you in this whole process?
The big surprise, I think, for us over the last year has just really been so many different opportunities that are coming at us from all different angles, from either channel opportunities or product enhancement opportunities, and it's having the insight to really stay laser focused on our core product. But there is a reason we named the company SoloHealth, and it's not just about eye care. We're going to build a beachhead around vision, but there's some emerging trends going on with self-service technology and with consumer-driven healthcare that we think we're right in the middle, being able to take advantage of that.
Now, when you first started, that was the vision, or did you, in so many cases, start out, even Google and some of the names that we are so familiar with, started with a laser focus, but they kind of went on a detour, and the detour ended up being an even bigger opportunity than their central focus. So this whole idea of self-service health screening, was that something you had in mind right from the beginning?
It was.
And so this was meant to be product one in a series of things.
That's correct.
Huh.
That's correct. That's the reason the company's named SoloHealth. One of our early advisors, Bill Longley, Bill happens to live here in town. Bill was one of the pioneers in the blood pressure machine business. Bill had 15,000 blood pressure machines, is now a shareholder in our company, and he helped me realize over 3 years ago that if you can be with a business where everyone wins, try to capture that, and we can add additional features and functionalities as it goes along, but we want to build a beachhead around what our core is, and that's in the vision space.
Now, have you looked into totally diversion? I don't know, maybe not so much I guess the distribution system, not necessarily the service, but things like the driver's license, the DMVs, and those kind of things, government agencies. Have you ever considered working with any of those?
Absolutely. We'd love to. In fact, I don't know if you've realized it, the government has invested millions of dollars in technology to allow all of us to renew our driver's license online. Mm-hmm. And they've done a great job with it. It's met very little resistance. And the reason they did that is they wanted to have a better consumer experience but also reduce labor costs. But what happened in the process is the vision screening requirements had to change. And in the state of Georgia, you can get a driver's license when you're 16 years old, get your vision screened, and not have to do it again until you're 64. Mm-hmm. Your vision deteriorates a lot between the ages of 16 and 64. So there's a lot of people out there driving that perhaps shouldn't be because they don't have the best visual acuity. And we think there's really an opportunity to do that.
So you'd have land-based criteria that could be done on the kiosks that would be then used online, or how would that work?
I can't share too much at this point. Where it's fairly early.
Pretty exciting. I could see that as another detour of a lot of sort of brick and click type connectivity.
That's right. I mean, you can think about how you get your emissions tested, and you go and you pay $25 at your local facility, and then that gives you the authorization to renew your automobile.
So I can see exactly. I guess we have to ask this question. Everybody's being faced with the reality of the current financial situation. How has the economy affected your business? You say 5 years in, and you're obviously still in a lot of early startup stages. Is the economy helping, hurting? Just what exactly has been the effect?
On the capital raising, obviously it pushes out, and it's more difficult to raise money. At the same time, though, what we found is it's actually helped us on the strategic front and from the eye doctors and the people we work with, because what we have is we have a technology that actually is designed to increase traffic and drive more people into their business. So as the economy tightens and people put off getting an eye exam and they put off getting regular health care, this is a way to quickly educate them on why it's important.
Sure.
And we're going to feed the funnel. So we're going to be putting more people into the doctor's chair. And anytime we can do that, they're willing to pay for that, even in a tough economy.
That horrible logic, but it seems to come clear in so many cases, and that is a crisis is a terrible thing to waste. Here's a case where, in actuality, the economic situation may be actually helping to get distribution or more distribution because you're actually bringing some new idea and new marketing concept to the entire marketplace. Give us a little idea about the horizon for SoloHealth. What else is on the horizon?
So we're focused on education, awareness, and action, and we want to educate more people using various health self-service vehicles. And we just applied for a government grant through the NIH that goes directly after providing health and information services to kind of the different disenfranchised or those people that don't have access to regular care. And we want to become SoloHealth. We want to use vision as the beachhead, but use self-service technology and use consumer-directed healthcare and those two major growth trends and really try to capitalize that.
Pretty exciting, Bart. We've been visiting with Bart Foster, local entrepreneur, CEO and founder of SoloHealth, and the idea called the Eyesight Kiosk. Bart, thank you for taking a moment out of your day and joining us here on Tech Talk.
Thanks. Appreciate it.